can help to contain the spread of the coronavirus. Wear a mask, wash your hands frequently, physically distance, and download the WeHealth Bermuda app today. How does the app work? After a person is tested, if they are positive for the coronavirus and have downloaded the WeHealth Bermuda app, they will receive a code from the Ministry of Health. The person will enter that code into the app, and WeHealth Bermuda will anonymously notify other WeHealth Bermuda app users that an infected person was in close proximity, even if they don't know that person. Because the WeHealth Bermuda app does not use or collect personal information or track users' locations, these notifications will be completely anonymous. WeHealth Bermuda uses Bluetooth signals to measure how long and how close app users were together. Once you download and install the app on your smartphone, the app will run in the background and alert you to any exposure risks. It uses very little data or battery life and will continue to work if your phone uses Wi-Fi only, as long as Bluetooth is enabled. We are using the power of technology to defeat the coronavirus. Download the WeHealth Bermuda app today. This message was brought to you by the Ministry of Health.
Good evening, Bermuda, and welcome to the members of the media who join us here today. I am joined by the Minister of Health, the Honorable Kim Wilson, Deputy Premier and Minister of Home Affairs, the Honorable Walter Rovan, and the Minister of National Security, the Honorable Renee Ming. And my colleagues will provide an update on their respective ministries, and following that, I'll provide an update on matters related to the coronavirus. First, we will go to the Minister of Health. Minister?
Good afternoon, everyone. There were 1,000 test results received by the Ministry of Health since the last update, and 6 were positive for COVID-19. Arrived on the BA Flight 2233 from London on the 16th of December 2020 and tested positive on their day 4 test. One of the new cases is classified as local transmission with a known contact or source as associated with a known case. The remaining new cases are classified as under investigation. These cases are among residents with no currently identified links to other known cases or clusters or history of travel in the past 14 days. Additionally, 4 cases have recovered since the last update. Bermuda now has 553 total confirmed positive cases, and their status is as follows. There are 253 active cases, of which 249 are under public health monitoring, 4 are hospitalized with none in critical care. A total of 291 have recovered, and the total deceased remains at 9. The mean age of all confirmed positive cases is 43 years, and the median is 39, and the age range is less than 1 year to greater than 101 years. The mean age of all of our currently active cases is 36, and the median is 31, and the age range is less than 5 years to greater than 80 years. To protect privacy and confidentiality, the average age and age range of the hospitalized cases, will not be provided. The mean age of all deceased cases is 74, and the median is 74 years, and the age range is less than 60 years to greater than 80 years. The source of all cases is as follows. 148 are imported, 324 are classified as local transmission, of which 302 are local transmission with a known contact or source, and 22 are local transmission with an unknown contact or source, and 81 are under investigation. As investigations proceed, transmission categories may change. Today's update has 4 cases moved from under investigation to local transmission with a known contact or source, as they are all associated with known cases or clusters. The 7-day average of our real-time reproduction number is less than 1, and it's 0.78, and Bermuda's current country status remains at clusters of cases. Health has changed how the age breakdown of cases is being reported. Understanding that the purpose of public health communication is to provide information for action and behavior change, there needs to be a balance between the level of information supplied to the public and the privacy and confidentiality of persons diagnosed with COVID-19. As such, today and going forward, specific ages of cases are not being used in the reporting of age ranges. Additionally, if there are a small number of cases in any particular category, such as active cases or hospitalizations, an age breakdown will not be provided. Given the higher number of positive cases reported in recent weeks, it should be noted that the majority of transmissions have occurred in recreational environments. As Bermuda's gateway cities experience a second or third wave of novel coronavirus infections in the fall, it was almost inevitable that we would see a corresponding uptick in infections here in Bermuda as well. Whilst this did happen, it is important to point out that the spread of COVID-19 throughout Bermuda is on all of us. We cannot simply blame the traveler. We must take ownership for the health of our island, as it is our own individual actions as residents which make the difference and break the chain of the spread. When the Ministry of Health asked everyone to avoid the 3 C's, closed spaces, crowded places, and close contact settings, this is why. Over the course of one weekend in November, there were 3 gatherings of people at 2 venues that resulted in more than 80 people testing positive for and contracting COVID-19 and 550 people being placed in quarantine one weekend. One of the venues was a sports club where numerous people became infected. Investigations by our contact tracers indicate that from there, a bar, a retail business, another club, and several workplaces ended of December, 205 people tested positive, and we continue to feel the impact of the transmission which occurred on that one weekend in November. This holiday season, we must, as a community, follow the public health guidance and measures that are put in place to stop the spread of COVID-19. We cannot be irresponsible about COVID-19. It is a virus that is so easily transmissible. Our vulnerable populations require all the protections we can possibly give them by shielding them against this virus. So please be safe this holiday and avoid the 3 C's. And if you are a student who has returned home from study overseas recently, or think that you may have recently been in contact with a positive case, think carefully about every interaction you have. If you are a returning traveler who has not received a negative day 14 result, do not go around to visit your grandmother at her house. Do not go over to your friend's house whose mother is going through chemotherapy. Do not visit your pregnant sister or your diabetic aunt or your elderly neighbor. We must protect our vulnerable. And also, if you will be hosting or attending a gathering during the holiday season that brings people who live in different households together, please listen to and adhere to the following. There should be no more than 10 people together at one time. Ensure people from different households are able to remain at least 6 feet apart. Guests should avoid direct contact, including handshakes and hugs, with others that are not from the same household. Host outdoor rather than indoor gatherings as much as possible. Avoid holding gatherings in crowded. Increase ventilation by opening up your doors and your windows. Require guests to your household to wear masks except for when they're eating and drinking. Limit the contact with commonly touched surfaces or shared items such as serving utensils. Clean and disinfect commonly touched surfaces and any shared items between the use where feasible. Plan ahead and ask guests to avoid contact with people outside of their household for 14 days before the gathering. Wear a mask while preparing the food or serving the food to others who do not live in your household. limit the people going in and out of the areas where food is being prepared or handled, such as in the kitchen, and wash dishes in a dishwasher or with hot, soapy water immediately following the gathering. The more of these preventive measures that you put in place, the safer your gatherings will be. No one measure is enough to prevent the spread of COVID-19. I would also like to issue a reminder to both retail and grocery stores to please continue to enforce the physical distancing during this busy time. Likewise, I would like to remind customers to adhere to the physical distancing directives. Markers are placed on the floor for a reason. Just because you are wearing a mask, that doesn't mean that you can stand closely behind the person in front of you while lining up at the cashier or reaching past someone for something on a shelf. While winter camps for children are open and able to operate, there are a few stipulations for operating. Attending children must be 5 years or older, otherwise organizers will technically be operating daycare centers, which have their own set of rules and guidelines. Camps must register with the Ministry of Health and the Department of Youth and Sport, and the registration form can be found online at gov.bm. Camp group sizes are limited to 10, and this includes staff and children. And there needs to be a large enough indoor and outdoor space so that 6 feet distancing can be maintained at all times. Accurate records must be kept by organizers for contact tracing purposes, and staff must be vigilant for COVID-19 symptoms every day and take steps to minimize the risk of spreading germs. For example, children should be kept in the same groups with the same staff member throughout the duration of the program. Children should not be mixed with one group to another or activity to activity, and water bottles, food containers, and toys should not be shared. For more information regarding the camps, please visit gov.bm/camp guidance. The Ministry of Health would also like to advise the public of an unfortunate glitch which occurred at the MDL lab last week that led to the issuance of false negative test results to a number of people who were in fact COVID-19 positive. This is extremely unfortunate, and the ministry fully understands and regrets any distress or confusion caused to individuals and their close contacts regarding the false negative results. I've been assured by the lab that they have reviewed their processes and structures and put in place measures to ensure that this doesn't happen again. For those who do test positive and who are quarantining, as are their close contacts, I can advise that the Bermuda Regiment soldiers starting today are currently being deployed as our COVID marshals to conduct quarantine checks. They are in teams covering East, West, and Central parishes. They are checking to ensure quarantine requirements are being met and also checking on symptoms and providing contact phone numbers if those quarantined individuals have any questions. If you are supposed to be quarantining, make sure the COVID marshals find you at home. Also, there have been a number of questions regarding the new strain of coronavirus. On the 14th of December 2020, authorities of the United Kingdom reported that a SARS-CoV-2 variant had been identified through a genomic sequencing. Given that this strain can be dated back to September of 2020 in the UK, the latest report from PAHU states that it is likely this virus is already circulating elsewhere. Further studies are needed to determine if this new strain is different in terms of the severity of the disease that it causes. However, the United Kingdom government has reported that there is no evidence at this stage to suggest the COVID-19 vaccines currently being rolled out across the UK will not work against the new variant of coronavirus. And it is important to note that all viruses do change over time. There have so far been hundreds of variations of this virus identified worldwide. To date, most changes of this virus have had little to no impact on how it transmits or the severity of the disease it causes. The occurrence of mutations is a natural and expected event within the evolution process of the virus. Evidence indicates that the SARS-CoV-2 viral variants identified to date have a much lesser influence on the transmissibility and severity of COVID-19 than other risk factors such as age, underlying conditions, or even social behavior, which we've talked about earlier this evening. Bermuda has been routinely sequencing has not to date been routinely sequencing our positive cases, so we cannot say for sure if this particular strain is already circulating. However, there is something we hope to start doing in January, as we do have the equipment to conduct nanopore sequencing on island, and this will be led by Dr. Karika Weldon, who was the project manager and lead researcher for nanopore sequencing at Oxford University. On balance, as the virus strain has been around since September, it seems unlikely that it isn't already here, which is why we have not closed our borders to the United Kingdom. However, the ministry is putting in place additional quarantine restrictions for those traveling to Bermuda from the United Kingdom and those who have traveled in the UK in the past 14 days before coming to the island. Regardless of whether or not those UK travelers have a pre-arrival test, they will be required to quarantine in their accommodation for 4 days and cannot be released from quarantine until they have a day 4 negative test result. This will provide an added layer of protection for all of us. In closing, I would like to remind the public about the availability of the Community Mental Health Wellbeing Hotline at 543-1111, and this line is open Monday to Saturday from 5 to 9 p.m. And the Wellness Hotline is for those who are feeling anxious, people who may be stressed while taking care of loved ones, seniors who may feel isolated, people who are having a hard time with this isolation, and those caring for loved ones who just want to chat. Those are just a few of the examples for persons to call, and we would invite anyone to call that number if they are feeling anxious and require any type of additional support. Again, it's the Community Mental Wellbeing Hotline at 543-1111. Support is free of charge to the public, as funding has been made available through the Bermuda Foundation with support from the Health Innovative Fund. Thank you, Premier.
Thank you, Minister Wilson, and I want to thank you and your team for the exceptional work that you've been doing over the past few weeks in tackling this outbreak. I'm grateful to see the numbers coming down and you being able to report single-digit figures today. Our positivity rate has certainly been below 1% for the last few days, and certainly the further reductions are, of course, are welcome. And without question, the keeping up with the high rate of testing, which is essential to ensure that we tackle this current outbreak, is certainly good to see. I know that if we as a country continue to do what is required, I'm certain that with the work of your team and the work of everyone else, that we will see an end to this outbreak. Last week, Friday, we experienced a power failure that affected all of Belco's customers. The Deputy Premier is the Minister responsible for regulatory affairs, which includes energy regulation, and will give an update on this matter on behalf of the government. Deputy Premier.
Thank you, Premier, and good evening to everyone, and also good evening to Bermuda. Last week, Friday, the impact the island felt for the island-wide outage went far beyond the loss of electricity. Government is aware and sensitive to the fact that many businesses lost revenue as a result of their forced closure, which also had an adverse effect on their staff, and the staff would have also lost wages as well. This unforeseen occurrence has undoubtedly added to the current hardships being experienced by all residents, businesses, and employees due to the pandemic. The government empathizes with all who were affected. Unfortunately, for the residents of Bermuda, this is not the first time that a blackout has occurred this year. All but the previous occurrences was not an island-wide occurrence or an island-wide event. It just happened in August of this year, 2020, that virtually all of the West End, from Warwick all the way to Sands, lost power. Yesterday, just yesterday, there was loss of power to over 300 customers of the utility. This sequence of this disruptions, while I am sure is of great concern to the community, I must emphasize that it is of grave concern to the government. I have informed the chairman of the Regulatory Authority of Bermuda of government's position that BELCO, the licensed utility, sole generator and transmission and distribution provider, must be held accountable and answerable to the residents of Bermuda. As the only provider that currently holds a transmission and distribution and retail license, BELCO has a greater duty to ensure that there is a plan to mitigate all risks within their control, whether maintenance, security, or otherwise. Such events as the one that occurred on Friday does nothing to enhance the island's reputation, especially as defined by Section 6 of the Electricity Act 2016, which outlines the purposes of the Act, and particularly Clause 6A, which states, and I quote, "To ensure the adequacy, safety, sustainability, and reliability of electricity supply in Bermuda so that Bermuda continues to be well positioned to compete in the international business arena and global tourism markets." As the Minister responsible for Energy and Regulatory Affairs, I have directed the RA to provide the Minister of Home Affairs with the following information as a matter of urgency. Firstly, the date it anticipates receipt of a full report from BELCO. Secondly, the date it expects the report on its assessments of the events of last Friday. And thirdly, its recommendations on how this matter should be addressed. The government is most concerned about the island-wide outage event last week and the other parish outages that are happening, obviously with much more frequency. Government will hold the regulatory authority accountable to make specific recommendations, including A, possibly stronger reporting requirements, such as risk mitigation plans, and B, possibly stronger penalties for noncompliance. My letter today, which I said I sent to the chairman of the Regulatory Authority, indicated that I expect a report on this as a matter of urgency. On behalf of the government and the Ministry of Home Affairs, I would like to reassure the public that we will and do all that we can to provide answers relating to the unfortunate occurrence of last Friday. Thank you.
Thank you, Deputy Premier, for that update. As of tomorrow, I will be taking vacation, and the Deputy Premier will be acting in my stead. And I am certain that all of Bermuda will support him with the decisions which may be required over the next few weeks, and I'm certain that he will continue to remain informed on behalf of the government. Next, the Minister of National Security will now provide an update from her ministry and will also cover matters related to enforcement of the public health emergency regulations that have been extended to ensure that we put an end to this outbreak. Minister Ming.
Good evening, Bermuda, and thank you, Premier. This evening, I will touch on matters to do with the Department of Corrections, the Bermuda Police Service, the Royal Bermuda Regiment, the Bermuda Fire and Rescue Service, and the Customs Department. First and foremost, I wish to extend my appreciation to all of our officers in these departments, as well as to the Disaster Risk Reduction Mitigation, the DERM team, who under very strained conditions ensured that our emergency services continued operating during the island-wide blackout last Friday. This national event caused considerable anxiety throughout our community. We are thankful that all of our uniformed services continue to safeguard and protect the public under extraordinary circumstances. Turning to the Department of Corrections, I can advise that all our facilities continue to operate without major disruptions or incidents. The department continues to manage our COVID-19 cases in accordance with the Department of Health guidelines and in keeping with the Department of Corrections pandemic plan. And the department will continue the regular COVID-19 testing of staff and inmates at all our facilities. I should note that all visits by members of the public to our facilities have been suspended until the end of this year. We will review the reinstatement of visitation in January 2021. Lastly, I want to once again reassure the public that we're taking all of the necessary actions and precautions to ensure that those who work and reside at our facilities are safeguarded and protected. The Bermuda Police Service. I advised last week that the COVID compliance team have stepped up their efforts in ensuring the community's compliance with the COVID-19 regulations. Regrettably, 10 persons were cited for various breaches of the regulations. As it relates to the COVID-19 violations, I want to be clear about the process, as there's been some commentary as to why there aren't immediate arrests and subsequent prosecutions. Simply put, if a breach occurs at a checkpoint or at an establishment or any other location, the Bermuda Police Service will take the requisite information or details of the person or persons in violation. A file is then compiled and sent to the Department of Public Prosecutions, DPP. The DPP considers whether there needs to be any further action, such as a court appearance. Make no mistake though, the Bermuda Police Service have a mandate to enforce the regulations and will continue to do so over the holiday period. As a reminder for this weekend, the Bermuda Police Service will conduct their roadside sobriety checkpoints. Also, they will have roadside sobriety checkpoints over the New Year's holiday weekend. So again, we're urging the public to make sensible choices. This includes exercising safe and responsible driving habits on our roads. Sadly, this time of the year, when we tend to see increases in road traffic collisions and antisocial behavior associated with alcohol. So we're urging people not to drink and drive, and make sure you have a designated driver. Also, I can advise that the Bermuda Coast Guard will have an operational presence on the island's waters throughout the holiday period, enforcing all regulations. Boat operators are reminded of the updated laws regarding drink driving on the water, and to always act in a manner which puts everyone's safety first. Additionally, boaters are reminded of the current maritime restrictions that prohibit recreational use. The Public Health COVID-19 Emergency Powers No. 3 Regulations 2020 only permits the use of boats for recreational purposes up until 6 p.m. A maximum gathering of 10 persons is permitted. Rounding out the public safety briefing, I'd like to share some crime prevention tips, as this is the time of the year when we see an increase in residential break-ins. Residents are encouraged to always lock their doors and windows when leaving home, even for a few minutes. If leaving home for an extended period of time, ask a neighbor or family member to watch the house. Displays of holiday gifts should not be visible through windows or doors. Be aware that criminals sometimes pose as couriers or persons soliciting donations for charitable causes. Always ask for identification and ask how the donated funds will be used. If you're not satisfied, do not donate. Only donate to recognized charitable organizations. When out shopping, avoid carrying large amounts of cash, and where possible, pay for purchases by check, credit, or debit card. Keep car doors locked and windows closed when you are away from the vehicle. Don't leave purchases in the car seat. Instead, lock them in the trunk. Further crime prevention advice can be found on the Bermuda Police Service website at bermudapolice.bm. In my statement of December 17, 2020, I communicated safety tips from the Bermuda Fire and Rescue Service. As we are now nearer to Christmas, I think the tips are worth restating. As a reminder, test your smoke alarms. Water live Christmas trees on a regular basis. Place Christmas trees away from sources of heat. Keep lit candles away from decorations and other materials that can burn, and blow them out before leaving the room, home, or going to bed. Do not burn Christmas tree branches or wrapping paper in fireplaces. Do not overload electrical outlets. Utilize surge protectors. Finally, I will end with an update from the Customs Department. The 2020 holiday season has been an extraordinarily busy time for Customs, with residents importing courier packages from abroad in record numbers. This is in part due to the reduction in overseas travel by residents. We understand the public's eagerness to have their packages cleared as swiftly and as efficiently as possible. However, Customs must also carefully balance their approach to prevent cross-border movement of contraband such as firearms, illicit drugs, and criminal proceeds. But in light of the increase of imported packages, Customs has modified their operational measures. To that end, Customs has maintained communication with all courier services to troubleshoot critical areas and enact solutions where needed, maintained peak staffing levels by transferring staff from other areas of the department to assist in courier operations, used non-intrusive inspection technology such as X-ray, drug detector dogs to assist in the examination of arriving packages and thereby reducing the time spent on physical inspections, taken steps to expedite the clearance of sensitive materials and emergency medical shipments, relax the requirements for non-commercial importers to register for a Customs Automated Processing System, CAPS ID number. The deadline for registration has been pushed back to the 31st of January, 2021. And lastly, Customs has allowed courier services to use the temporary CAPS number of 99999 for declaring personal goods. Again, we understand the public's desire in seeking to clear their imported goods and packages as quickly as possible. But our customs officers are doing their level best to assist where they can and within reason. It's hoped that the public can appreciate our need to balance our clearance protocols and our need to ensure the national security of our borders. I would like to take this opportunity to wish all Bermuda residents and visitors a very Merry Christmas and a prosperous and healthy New Year. Thank you.
Thank you, Minister Ming. On Friday, you will not only celebrate Christmas, but you will also celebrate your birthday. And so I'm wishing you a happy birthday on Friday when it comes. Since reopening our economy and inviting visitors, Bermudians and visitors have fought the coronavirus by wearing masks, practicing social distancing, and washing hands frequently. The government has managed the pandemic by deploying public health officers to the airports, implementing science-driven protocols and measures to reduce behaviors that spread the coronavirus. And in doing all we can to test, and test even more. Yesterday, the United States Centers for Disease Control issued a travel warning for Bermuda and deemed the level of cases that we have as very high. We were deemed so because the CDC has a standard where very high equals having more than 100 cases in 28 days. And clearly, our recent outbreak has met that threshold. While the CDC will issue advisories, I must reiterate that the statistics given by the Minister of Health, the 7-day average of our real-time reproduction number now continuing to fall further, with single-digit cases that were being reported today, and Bermuda's current country status is at clusters of cases. Given that the infection rate is dropping, our positivity rate is dropping, and we can expect the number of active cases to also decrease, while the number of recoveries will continue to rise. These are the expectations that we have for the future, but our behavior is certainly the biggest influence on that data. We have a track record of robust testing and contact tracing, and we are still one of the safest places in the world to live and to visit since the pandemic started. To be clear, I do not believe that this rating accurately reflects our island's current health and safety, and that visitors who come to Bermuda are at a high risk of catching the virus. I'm confident that as our cases continue to fall, the CDC will review this rating and will make the appropriate adjustments in the future. Bermudians will be aware that given the number of confirmed cases since the beginning of December, there has also been a substantial increase in the number of persons being tested. In fact, between the 3rd of December and yesterday, we have conducted and analyzed 22,196 tests. You may recall that the government committed to carrying out 1,000 tests per day, and our dedicated officers are beating that average by making it up to 1,230 tests a day. Well done to them. Bermuda has the highest per capita testing rate in the entire world, and it is the reason why we have been able to capture this outbreak, remain at clusters of cases, and now beginning to see that the number of positive tests of which we're reporting are less. But it is not because we are testing less. We are keeping up this testing rate to make sure that our country remains safe. As the rise in testing has created a greater need for officers to contact trace than at any time previously, the Ministry of Health brought on more officers to communicate with those who were exposed to someone who tested positive to the coronavirus. The results show that residents are the vast majority of confirmed cases and not visitors to our islands. If we are in gatherings and we don't wear a mask, maintain physical distance, or observe appropriate hand hygiene, we are more likely to get the virus from a friend, neighbor, relative, or coworker than we are from a visitor to Bermuda. Accordingly, I'd like to take this time to applaud our tireless frontline officers because contact trace requires empathy and sensitivity, and the news can be frightening to those who receive the calls. The government sincerely thanks you for your hard work and professionalism. The Cabinet Committee on the Coronavirus met yesterday to discuss possible changes to the public health emergency regulations that will be in place for the next 2 weeks. There were a number of requests for changes, such as making exemptions over the holiday and possible curfew relaxations for New Year's Eve. There was also a discussion regarding possible enhanced restrictions in light of the new variant of the coronavirus, which, though in the UK, is in many countries around the world. Following our discussions and after consideration, the decision was for there to be no relaxation of restrictions for any days, as we are still in a critical state, and the most important thing for the country is to curtail this current outbreak and bring it to an end. The Ministry of Youth, Culture, and Sports is working with our Gumbays who have agreed to not perform on Boxing Day to see if we can have safe performances on New Year's Day. The Deputy Premier will be able to provide more information on that at next week's press conference. The only minor change in the regulations that was agreed was for licensed hotels to be able to serve their guests in their facilities after 10 p.m. This is only applicable to registered hotel guests, as the current rules require that all hotel activity except room service cease at 10 p.m., and the curfew will remain in effect. This change will take effect from tomorrow and run through this period of extension, which will be reviewed on January 5th. The Minister of Health has detailed the additional precautions being taken in regards to travelers from the United Kingdom, and it is important to note that the government makes all decisions based on science. In today's media environment, it is easy to overreact. And though we have been successful by implementing proactive measures, it is important that we remain balanced in our approach and our responses are appropriate and proportionate. Our tests are able to detect someone who may be positive with the new variant. And unlike other countries that have implemented restrictions, every person who enters Bermuda is tested, and that provides an added layer of protection for us. I also want to remind residents that the unemployment benefits are available for verified employees of bars, nightclubs, and members clubs who have had to close due to the current COVID-19 restrictions. Assistance is also available for those who have been required to quarantine by the Ministry of Health and are unable to work from home. The total benefit for these persons will be $500 per week for the period that these restrictions are in place. The initial benefit of 2 weeks or $1,000 was paid last week to individuals who have completed application submissions, including employer verification. Additional payments were made this week, and those that have been approved will also receive a payment for the next 2 weeks if they are verified employees of bars, nightclubs, and members clubs, given that the restrictions have been extended for a further 2 weeks. We encourage all eligible employees and employers to take the time to properly follow the process to ensure that payments can be made on a timely basis. The link to the application form can be found on the top red banner on the government website, gov.bm. In addition to support employers, the BEDC will be providing emergency grant funding to assist businesses impacted by the new restrictions. The one-time grant relief is a needs-based funding product that will be available specifically for approved bars, nightclubs, members clubs, and restaurants as of December 8th. The relief will be granted on a case-by-case basis, and businesses must be registered with BEDC to apply. Businesses who have been impacted can go to bedc.bm to apply for the emergency grants. Funds will be provided to cover immediate monthly overhead expenses, excluding salaries which are being met by the government's unemployment benefit. Approved grants will only be provided for the following overhead expenses: business location rent, utilities, social insurance, and health insurance premiums. We must continue to do everything to contain and manage the virus on our shores. In addition to the measures that we've been practicing since the spring, or I should say, since the winter, we are now using technology to help us. The WeHealth Bermuda app was launched on December 11th, and since then, 17,000 persons have downloaded the app. To those persons, I say thank you. The app is designed to slow the spread of COVID-19 by notifying app users of potential exposure. It is one of the most sophisticated applications available anywhere in the world for helping to control and minimize the spread of COVID-19. When smartphones that have WeHealth Bermuda installed are near each other, the app uses anonymous Bluetooth signals to determine how close the devices were together and for how long. So far, 11 people have been confirmed positive who have been using the app and have been given a random code to put into the app. This means that they have been able to notify people who they're in close proximity for long enough to possibly have transmitted the virus. Due to the private nature of the app, we cannot state how many notifications were sent by the persons who entered the code, as the government does not have access to the information due to the privacy features which are built in to the way that this application has functioned. However, it is good news to note that the people are being assisted because of the usage of this app, and I strongly encourage all persons to make sure you download the app, especially if you are mobile. You can learn more about the app by visiting gov.bm/wehealth, or you can email covidapps@gov.bm. I am aware that as the number of positive results began to rise, people's anxiety also increased. I'm also aware that the deluge of false and uncorroborated information can create additional anxiety among people, which is why I urge people to only follow official notifications and sources. If you get information that you are not sure about, please do not forward this information, as they could very likely be false. If you want more details from the government of Bermuda, visit coronavirus.gov.bm, as the information is there and updated regularly. The government WhatsApp service continues to provide information to the public, and I encourage everyone, if you have not yet 6045. Again, the phone number is 504-6045. Save it to your contacts and send a simple message that says hi, and you will begin to receive WhatsApp updates directly from the government of Bermuda. You can also receive notifications through the government of Bermuda's Tree Fog app, which can be downloaded from your app store. To provide support, as the Minister of Health stated, the Emotional Wellbeing Hotline is there to assist persons with their emotional well-being as they deal with the pandemic's effects. You will have access to qualified, experienced mental health practitioners to talk to you if you're feeling anxious, sad, overwhelmed, or stressed. If you need someone to talk to, help is available, and the Emotional Wellbeing Hotline number is 543-1111. The line is open from now until January 30th, 2021, and available from Monday to Saturday from 5 p.m. to 9 p.m. People are encouraged to call the Emotional Wellness Line, and the support is free to everyone who calls. And I want to thank the persons who have supported this effort by donating their time, supplying their time, and also to the Bermuda Health Foundation with the support, and also the Health Innovation Fund, which has been funding this effort. Certainly, also affecting our emotional well-being is the fact that the government has had to implement restrictions during this festive period, a period in time where we traditionally spend with family and catch up with our loved ones, making being alone or certainly being quarantined more difficult to bear. Regrettably, as we have had to ask people to not mix households during Christmas, we have also had to curtail activities such as gumbays, restrict the size of gatherings. These actions are necessary, and though they are tough, it is important that we keep Bermuda safe. However, leaving aside the true reason for the season, I would say that in some regards, this Christmas may be more Bermudian than those in the recent past. In the past, Bermuda Christmases were wholly about family, food, warmth, and love. But lately, we have gotten lost in iPhones, iPods, and iWants. In 2020, if we cannot buy, maybe we can share. When we cannot visit, maybe we should call. And if we cannot travel, maybe we should Zoom into each other's living rooms. There are government and helping agencies, churches, and individuals who are skilled and trained in supporting people during tough periods. Utilize their services if you need to, and materially support them if you do not require the services. I want to thank the many organizations who have been working for the last 9 months to ensure that we provide support for those in our community who have been affected by the economic impact of this pandemic. Those who provide meals, financial assistance, and support for those who are challenged to make ends meet. Our corporate community, our political community, our religious community, and our community organizations have all come together in so many ways to support those in need. It makes me incredibly proud to witness us as a country working together to provide this support. I know, certainly, Bermuda, that it has been a difficult and challenging year. We have all had to do things differently, and I'm sure that never of us imagined living through a once-in-a-century pandemic. But we can look back on this year thankful for everything that we have accomplished. I'm thankful for us coming together as a country to work in a unified fashion to tackle this virus. Christmas in Bermuda is about sharing meals and spending time with our families. However, as the Minister of Health said, the safest way to celebrate during this holiday season would be within your immediate household, practicing safe distancing in a Christmas bubble. Please be safe, and please remember to protect the vulnerable and our senior citizens. As the Ministry of Health, we are seeing the average age and also the age ranges of persons who have been infected recently to increase. This is certainly due to contacts within families and other settings with older persons. Until this outbreak is curtailed, we must continue to shield our elders and the vulnerable, and continue to treat all persons as though if they may be asymptomatic carriers of this virus. In closing, Bermuda, I have no doubt that we will get through this latest outbreak, and we will be able. However, let us take this time and this holiday to reconnect with family and relax after what has unquestionably been an incredibly stressful year. From my family to yours, and on behalf of the government of Bermuda, I wish everyone a Merry Christmas. May God bless your family, and may your holidays be safe and peaceful and filled with joy. And with that, I'm happy to take questions from members of the media.
Yes, good evening. Good evening, Trevor Lindsay, TNN. Premier, with the CDC telling the world that Bermuda is a high risk for the COVID-19 virus, are we likely to see international sporting bodies review their plans to stage events on island? For example, with the major sailing event that is scheduled for 2021. If so, what can we do to reassure these international bodies that we are indeed better prepared than they say we are?
Thank you for the question. And from wearing my hat as the Minister responsible for tourism, it certainly is a concern. But what I would say is that the U.S. CDC has laid out their criteria for their particular travel warnings, of which they have, and that criteria is theirs. What I can say from our aspect, we recognize the statistics that the Minister of Health reported today. There'll be additional statistics that have been reported tomorrow. Those statistics will likely be the best statistics that we've been able to report in a number of weeks. And the fact is that we have come and gotten control of this outbreak. I am certain that we will be able to, with adjustments which are made to any controls of which we have, and to ensure that we minimize the possibility for onward transmission of this virus, that we'll be able to host such events. And so from the perspective of the government of Bermuda, we will continue to work and liaise with our partners. We have not been informed of any such concern. And as I stated, the threshold is a low threshold. The threshold is a one-size-fits-most threshold. It doesn't take into account positivity rates. It doesn't take into account the amount of testing of which an individual country is able to do. It doesn't take into account all these variants. So, as I said in my statements, I do not agree with the assessment that persons are at a very high risk of contracting the coronavirus if they visit Bermuda, but the criteria is set, and we will continue to do our part to make sure that all visitors are safe. I can say this without question. You'll have a less likelihood here than you would in the United States.
Were we guilty of patting ourselves on the back too much during the early going of this pandemic, perhaps signaling that we were totally out of the woods? Was that a little bit too premature?
I wouldn't go so far as to say a little bit premature. I don't think we've ever said that we're totally out of the woods. I think that we recognize the reasons why the Minister of Health, myself, and continued to make sure the Minister of National Security and others have continued to go ahead and promote. The need to continue to be vigilant. But without question, when you go so long without a number of cases that were locally transmitted, et cetera, that is natural human nature. But I think that we've certainly learned in this aspect. And as we go forward with the adjustments of which are going to be made, I think that will be helpful. And I think that we have causes and hopes for optimism as vaccines will be arriving in the first week of January, and we'll be able to implement a vaccination program that will be able to assist those persons who may be vulnerable and who would like to receive protection from the virus.
The community is somewhat on edge considering thinking that a possible lockdown is possible. Could we see a drastic lockdown measure if the virus continues to spread on island?
I think we've answered that question a number of times, Trevor. It was not in any view of mine or the view and wish or desire of the cabinet to implement such a lockdown. The fact is that with the work of which the Minister of Health has done in leading her team with the Ministry of Health, the work of which our lab has been able to do under the leadership of Dr. Karika Weldon, with the absolutely remarkable what we have been able to accomplish over this past 2 weeks. We have been able to respond in a fashion with the help of our doctors, with the help of everyone, to bring this outbreak under control. And so with that, as long as we do what is necessary, I do not believe that we'll have to implement further restrictions than we have done already. As I said, I'm hopeful that we'll be able to report better numbers in the future. The reports of which we're getting from the labs is that we're having the best days of testing yesterday and today for a very long time, and we're just going to continue to keep that up.
In regards to the news of the COVID-19 variant, do we dare think about limiting flights from certain jurisdictions? With the situation in England and other European countries locking down their borders, we have our British Airways flight that comes in, and if numbers continue or if this virus adds up on our shores, would you consider putting a stop to the British Airways flight?
I think the Minister of Health addressed it in her comments already. Do you wish to add anything?
No, not particularly. As I said in the comments earlier, Trevor, we are confident that the further measures that we're putting in place under the Quarantine COVID-19 No. 3 Amendment Act, which will provide that any person traveling from the United Kingdom or alternatively traveling through the United Kingdom having been there 14 days prior to their arrival in Bermuda, regardless of whether they have a pretest or not, is required to quarantine for 14 days. It is likely, based on the evidence that we've heard thus far, as I indicated, that variant has been around in the UK since September. So it's very likely that it's already come to Bermuda, and other countries in the world have actually already identified that variant as well. So it's probably filtering around the world in any event. So we're satisfied that the restrictions that we're putting in place under the new COVID order, which should be signed, I guess, by the time I get back to the office, if not tomorrow, but it will be in place very, very quickly.
Thank you. And as I had indicated in my statement, Trevor, the new measures that are put in with the additional quarantine for persons from the United Kingdom or traveling from the United Kingdom for those 4 days, in addition to the fact that we test everyone that comes into the country. Countries that have implemented restrictions do not do that. And I think that we have to respond in these measures based on how we function. And I think I addressed that in our comments. So we have to take into account all things and act based on science and not just quick reactions due to, I would say, certainly headlines around the world.
You mentioned, Minister of Health, about the 10 persons family gatherings. What happens if you have a family with about 13 to 14 staying in the same proximity of one house? Is that, and this person asks, is they don't want to break the rules, but can they still gather with the whole family to stay in it? It's 3 different apartments to one house.
And thank you for that question, Trevor. A number of people have raised similar questions. What we are strongly encouraging is persons that remain within that same household. So you've just given me an illustration of 3 separate households.
But it's one family. It's one big complex.
We've seen people going to churches, sitting next to each other, saying, but we're all family. But they live in several households. That's not what we're speaking about. You and I are probably related, but we don't live in the same household. And I'm not trying to make
light of it.
I'm not. But because of the level of transmission that we've seen, it is involving social gatherings. We are deeply, deeply concerned that we do our best to shield our vulnerable. And inevitably, the household that you've just spoken about, there probably are individuals that are over 65 that have chronic conditions. So we were strongly, strongly encouraging persons to have a different Christmas this year, have a quieter Christmas with their immediate family that live in the same household of them. If they must, if they feel compelled to have all of the 4 units together, have it outdoors, physically distanced, make sure you wear masks. I went through a number of protocols that we're recommending if you must. But the starting position should be to have a small, intimate gathering with the persons that live in your household.
Thank you. I'm sure they're listening. My last question, Premier, and I want you change on the Brexit front. Things don't look good at the moment in regards to the Brexit talks. In Britain, there are different. In Britain, there are advisories in the event that there are no deals with Brexit. If there is no deal with Brexit, are we expected adverse effects if things continue in this negative manner?
No.
Sorry?
No. Sorry. No, we're not.
Good evening. The Ministry of Health yesterday told Bermuda Broadcasting, and tonight, Health Minister, you mentioned that we have not been routinely sequencing our positive cases, but that this is something that you hope to start doing in January. Why has not this been a priority, and wouldn't sequencing of the virus and knowing what strains are on island help with tracing the under investigation cases?
I wouldn't say that it's not a priority. Our priority actually was to set up and establish a very aggressive testing regime, which we did, and did it in short order. And as the Premier indicated, since the 3rd of December, we've tested over 22,000 people. That was our priority. Many, many nations, larger than Bermuda, some of the nations that you speak about the other day when you were comparing Bermuda to other nations, aren't necessarily doing nanosequencing. The United Kingdom, we know, is, and we anticipate that by January, we, with our population of 60,000 people, will also be able to do it. We have the equipment on island, we have the expertise in the name of Dr. Karika Weldon, and we will start doing that in January. But there's many, many countries that are not doing nanosequencing.
Thank you.
Don, it's making me think that nothing will ever be good enough for BBC.
I'm sorry, I couldn't hear you.
You're making me believe that nothing will ever be good enough for BBC. Last week it was, you don't have vaccines this week. Now it's, I would say on a broad measure, for a country as small as we are, with what we've been able to accomplish in the work of which we've been able to do regarding the testing and other things, I think that that is absolutely incredible. And so we are able to do so much more than other countries, because of the dedicated work of the teams at the Ministry of Health and also our Bermuda Government Molecular Diagnostic Lab led by Dr. Karika Weldon. So we're going to continue to implement and get better, but the fact is our priorities, as the Minister of Health stated, is to make sure to curtail these outbreaks and do this. I do know that there have been some samples that have been sent away to England for analysis from some certain things, but we will make sure that we commence that here on island next year.
Thank you. This morning I attended plea court via Zoom, and there were more than 20 people in that room. That's less than half the size of the Barclay cafeteria here. Yet this room is limited to just 10 people. Why is there a physical distancing for this room set at a higher standard than the one in the courtroom?
Well, I can't necessarily say that it's a higher standard than in the courtroom, but I'm happy to look into that matter. I know that in all places there are the various restrictions which have been laid out and adjustments that have been made to ensure that things are able to continue. So I'm happy to look into that matter, and hopefully the Deputy Premier can provide you an answer at next week's press conference.
Okay, thank you. Health Minister, in a press release on December the 18th, COVAX said that they were $4.2 billion short in raising funds to purchase vaccines. COVAX has also said that of the 190 countries that are part of the alliance, the 92 poorest will be first in line, which obviously would not be Bermuda. Can you explain how the COVAX facility works in relation to initially supplying Bermuda with enough doses for 4,500 people.
Thank you for that. Don, I'm sure you'd appreciate that we would probably all agree that none of us is safe unless we're all safe, and that there are certain countries that do not have the same level of GDP and resources that Bermuda has, who have not necessarily been able to pay into the COVAX facility. Bermuda has, so we have been assured that we will be able to receive our sufficient supply when the vaccines are made available. But when the COVAX facility indicates that there's a shortage, it's because some of the other countries, the poorer nations, have not been able to and may not be able to pay for a prescribed amount. But the whole facility itself is there to ensure that we have equal distribution amongst all countries. And just because you're a poor nation and have been unable to pay into that doesn't mean that your people should suffer and not be able to have adequate supply of the vaccination.
Thank you. The upper age limit of all our active cases continue to rise, 92 as of Saturday. This means more high-risk individuals are catching the virus. Other than restricting visits at care homes, what else can be done to protect our seniors?
Well, the main two things, I think one of them you just spoke about it, which is unfortunate because people would like to be able to have the opportunity to visit their loved ones, particularly this time of the year. However, because of the circumstances, you would have rightly indicated that there have been restrictions put in place. But the main thing that I think we can do for individuals that are vulnerable, that are not necessarily living in care homes, is to socialize with them from afar and not necessarily engage in physical contact, unless, of course, they live within our household. And there has to be a distinction drawn between persons that are vulnerable, such as our seniors that live within our household, versus ones that may be our neighbors or our loved ones that live in other households. And we are really trying to encourage persons to continue with the physical distancing, wearing their masks, hand hygiene, and the like. So if you must visit a senior, then we would encourage you to do so utilizing the same public health guidance that we've been repeating day over day, week over week, month over month in this case. And it sounds trite, but it's critically important. The great thing about COVID, if you can say something great, is it's avoidable. We can help to eliminate the transmission and minimize it by applying mitigants, simple mitigants such as wearing our mask and physical distancing. The evidence is strong. Wearing your mask helps to reduce the level of transmission. Washing your hands, keeping your distance helps to reduce the level of transmission. So if those guidance are adhered to, then we would do better in trying to protect our most vulnerable, which are, of course, are some of our senior population.
Thank you very much. Just to revisit the employers getting some sort of notification that an employee tested negative at the end of their 14-day period, why is there a privacy concern when the employer already knows that that person was out for 14 days?
Well, there could be a number of reasons why an employer was out for 14 days. It may not necessarily be because they are in quarantine or in isolation because of COVID. The issues of confidentiality we've spoken about, and that is patient confidentiality with respect to their status. And it's not a foregone conclusion if a person is out ill or for any type of medical leave that the reason that they're out is because they have COVID. So we can't make that quantum leap because a person has missed time at work that they have COVID.
All right, thank you. And I wish you all a very lovely holiday.
You too, Don. Thank you.
Thank you.
Good evening, everyone. Maya Palacio here from Media Maya. My first question, Minister Wilson. 2 weeks ago at a press conference, I asked if there was a possibility to get the age and gender of people who actually go to get tested for COVID-19 in Bermuda. Would you by any chance have those stats tonight?
No, I don't have that.
Okay, thank you. My next question, which will most likely be answered by the Deputy Premier next week, but I'll pose it up to possibly be answered. If the curfew is being considered, will it be lifted in time for New Year's Eve? People are wondering.
I think I covered that in my remarks, Ms. Palacio. I did say that the COVID Cabinet Committee met on Monday. That was one of the requests that were put to the government. We discussed it, and we thought that given the state of where we are, that would not be wise, and the curfew will be extended and will be in place from when the extension begins tomorrow until January 5th.
My apologies.
No problem. I know that a number of your readers have asked that, and I've seen the tweets as well. It was something that I said that I would take under consideration. We did discuss it, but given where we are, we felt that it would be best to leave things at this point in time. The last thing we want is for something to take place, even though there are restrictions. It's difficult to police people's private homes and other things, and to find ourselves when we're just coming to where we feel that we're having a grip and a handle on this outbreak to do things that will allow a possible spike. So we need to make sure we get through this time period, certainly, and that is the aim of the government, to make this as quick as possible so that we can return to a sense of normalcy.
Thank you.
No problem.
My next question, pertaining to the new or the second strain of COVID-19, what steps is Bermuda taking to identify whether or not we have the second strain on the island?
We will commence nanosequencing in January, led by Dr. Karika Weldon. We have the laboratory equipment already on island, and there are a number of minor matters that have to be addressed so that we will be able to commence that in January.
Thank you. Just one thing, Ms. Palacio, certainly as the minister had indicated, that we will commence the nanopore sequencing that will take place. But I think it's also important to note that this is not the second variant of the coronavirus. The coronavirus has had multiple different mutations which have taken place throughout the world. I don't want to put the number on it, but there's a significant amount. Viruses do mutate all the time. There's certainly heightened media attention to this particular variant and this particular mutation. But I think it's important to note that there have been multiple different mutations of the coronavirus which have been detected and identified. I think the most important thing to note that there is no evidence yet that, as is said, that this causes more severe illness. And the second thing that is more important to recognize as well is that there's been no evidence that the vaccines which will be received in Bermuda in the first week of January will not be effective against the coronavirus.
Thank you very much. My next question for Minister of National Security. As it pertains to this era that we're in right now, the season that we're in right now for Christmas, and you mentioned other things that happen around this holiday. One thing has been coming to me quite a lot from my generation is like thefts, particularly with bike thefts and things like that. Mm-hmm. What can people do in that situation? Like, what's the immediate response they should take when they found that their vehicle has been stolen? Because it happens a lot during this specific holiday, unfortunately.
Surely. Thank you for the question, Maya. I would encourage them to report the cycle center to the police, and you can use their number, which is the 211 number as well. And the reason for that is the police need to have that data to be able to even look at trends and to see if particular areas are being affected more than others. So I would definitely encourage them to report it to the police.
Thank you very much. My final question is about Chevelle Dillon Burgess, whether or not there's an update on her investigation.
I don't have an update other than the police continue to investigate, and actually we discussed in our meeting with the police this week, and they are actively continuing their investigation at this time.
Okay, thank you very much. Have a good holiday, everyone.
You too.
Good evening. With our status with the CDC being upgraded to very high risk, what impact do you think that is going to have on Bermuda?
I'm uncertain of the impact of which it may have. I think that persons who have decided to come to Bermuda for whatever reason may reconsider their plans, but I know that in the work with the Bermuda Tourism Authority, and as I'd indicated and stated inside of my remarks, is that the ratings change yesterday is more of a reflection of what has taken place in the country over the past 3 to 4 weeks versus what may take place in the country over the next few weeks. As we have seen, our real-time reproductive number, the 7-day average, is well below 1. The up-to-date daily rate is lower than the 7-day average, without question. We've reported single-digit cases today. We're expecting to report lower than that tomorrow. The fact is that we are continuing to be very aggressive, And in that case and instance, I think that we will be able to remind persons that it is safe. But it is on question that we did have an outbreak which was a very serious outbreak, which required the government to take some aggressive steps. But through the excellent work of the Ministry of Health teams and everyone involved, we are seeing that we're able to get a grasp of this outbreak. So the impact will remain to be seen, but the Bermuda Tourism Authority and other places will make sure that the message is that certainly we did have a challenge. Certainly that can be seen when you have a place with a curfew. There's certainly a challenge, but we believe that we're coming to the place where we can say that the outbreak is under control. But that's not going to stop us from testing, and that's not going to stop us from doing all the things which are necessary.
Okay. Is Bermuda looking to get the Moderna vaccine now it is FDA approved?
Looking, like I've said previously, the Pfizer is coming from the United Kingdom through our connections with the OTC and Government House. However, our COVAX facility, they've indicated that when it becomes available, they will be able to make the distribution. They haven't at this point said which one it will be, but it is likely that it will be the Moderna as well as the AstraZeneca once that becomes FDA approved. But I'll be providing public information as and when that information becomes available from COVAX.
Okay. Do you believe there is too much reliance on COVAX when it doesn't have agreements in place to distribute Pfizer and BioNTech or Moderna vaccines?
No, I think that is, I think the reliance that we have on the COVAX facility is based on what we've had previously and the involvement that we've had with the facility with respect to securing vaccines previously. So I'm very confident that they will be able to secure the vaccines when they become available, and Bermuda will rightly get the distribution that we've paid for.
I know you've in part addressed this, Premier, but Ms. Wilson, but are health teams preparing for a spike given the returning students currently?
We are looking at that. That is certainly something that's a concern that we hope to address, and no doubt the recent amendments to the public health regs with respect to the implementation of a curfew and the like will help to address that. We're also hopeful that parents will also play their role insofar as ensuring that their children are adhering to the public health guidance. Again, I'm not saying that we're not concerned, but the spikes that we've seen in recent weeks are not due to travelers. They're due to people that are heavily socializing at one particular event over a weekend.
Sure. And how are the testing facilities holding up? We've been hearing of long lines, long queues, some people not getting appointments. Are they managing okay?
Yes, we have increased our capacity starting, I think, 10 days, 2 weeks ago when we offered alternative testing sites as well as extended the hours. We also are providing for more persons to be able to test because of the extension of the hours. However, we have had a number of outbreaks, as you would rightly see, with respect to schools and other institutions, which would require those persons, because they were identified as close contacts, to have to be tested first. So I kind of used as an illustration a couple of weeks ago, similar to a triage system. When you go into the hospital, into the ER, they rate you insofar as the level of care that is needed and the emergency basis. So if somebody's there that, I don't know, perhaps has something minor versus somebody that has a more severe illness, and that person that comes in last, it's not first come, first serve. It's based on the importance and the level of severity. Likewise, because we've had a number of outbreaks, we needed to ensure that those persons that were close contacts in those outbreak situations receive the proper testing, because if we can identify COVID, we can isolate and help to deter the spread.
Okay. All right. Thank you.
Thank you.
Thank you. And happy holidays to you all.
Thank you. Thank you. I think that is the end of the questions from members of the media this evening. I want to thank the members of the media for their questions, their attendance at these press conferences, their coverage of which they give to make sure that we can relay information to the public. The next press conference from the government of Bermuda related to the coronavirus will be next week, Wednesday, December 30th at 5:45 p.m., and that will be hosted by the Deputy Premier. Again, next week, Wednesday, December 30th at 5:45 p.m., and that will be hosted by the Deputy Premier. So with that, it is time for us to sign off, and I am going to wish everyone in Bermuda a Merry Christmas and have a wonderful holiday.